Nowadays, it's all about having treatments available for our patients which are affordable. I remember very well when me and Didier Dietschi came the first time to Salt Lake City to see Dan Fisher, and when we presented that whole idea and that whole technology to him, he was very excited because right away he said, look, this is for 80% of the population, not like most of other technologies just driven towards, let's say, the 20% which can afford, and patients are not that easy to spend money, or they cannot spend money that easy anymore. So, well, we all know ceramic veneers are quite expensive. The fees end up for the patient between $750 and probably $1,500. It depends where we are, in which area we live, what kind of infrastructure we have to pay, personal costs, etc. And then of course we have to take impressions, we have to do temporaries, we have to send this all to the lab, so the lab fee comes into place, and so the costs are quite high for such procedures. Now, having this available in a direct way means that we don't have to go for, let's say, 2 or 3 chair times. We do everything in one session, and we all know the most expensive thing we have is our time. And actually, when we now go for these treatments, we are aware of the fact that composite and bonding is not the expensive part, from the material standpoint. As we work with bonding and composite underneath those shells, and these shells are, let's say, available directly to us, the costs are very different. So which means we might end up with costs of about $250 up to $450 per veneer, which means it's at least half of the price of what we normally would charge going for the indirect way. So as I said, it's a very affordable way for our patients to have a smile.